Hi, my name is Brandy Humphreys. I'm a registered nurse and I work at an acute care inpatient psychiatric hospital where we also treat substance use disorders. I would like to talk to you about our quality improvement project, how to decrease or eliminate contraband on the units of the inpatient psychiatric hospital. The management of contraband in the psychiatric setting is a severe issue, and implementing a standardized search protocol focused on patient centered care and following best practices could eliminate contraband in our hospital. What is contraband? Contraband is anything that could be considered harmful to a patient, whether it be drugs, alcohol, drug paraphernalia, ligature risk. It could be shoestrings, anything that could cause strangulation to the patient. It could also be considered any kind of weapon, sharp or metal object. Our current search protocol for contraband is not standardized. Everyone's doing something different within the hospital. And when patients come in, what one person considers contraband, maybe another person may not consider contraband. The incidents related to contraband has significantly increased in the past year. And just in the last 3 months, they have increased. We want to eliminate contraband on the units. And according to the Joint Commission guidelines, inpatient psychiatric hospital settings should be safe for the patients. The priority is to provide safe and efficient quality care. And in order to do that, we need to figure out how to make the hospital a safer place for our patients. Contraband being brought onto the units could be called an intake. When a patient comes in through the intake process, the patient is brought into the admissions room. Sometimes they're there for 30 minutes, sometimes they're there for 2 hours. The important part of the education is to educate the entire hospital staff. That includes dietary, housekeeping, maintenance. Every employee should be able to correctly identify contraband. This will help our hospital become contraband free. For example, if a patient is in the dining room and they have contraband and they're going to harm another patient, a dietary worker may be able to identify that contraband and prevent an incident from occurring. Housekeeping cleans the patient's rooms. And if a housekeeper identifies a harmful object or contraband, they can alert the mental health technician or the nurse and prevent an incident from happening. Maintenance. They are in the patient's hallways. They're in the patient's rooms repairing things. And if they are able to correctly identify contraband, we can eliminate contraband in the hospital. One of the things that we're going to implement is a contraband training upon all new hire in the human resources training room. The quality improvement nurse and the nurse educator will develop a PowerPoint presentation. It will be about 30 minutes in the human resources training room. There will be a quick 5-minute pre-test and post-test regarding the contraband education, and they'll go over every item that's considered contraband. If we educate all employees and they're able to correctly identify contraband, we can eliminate contraband in the hospital. And this is very important for patient safety. Every department head will be responsible for ensuring that their staff within 30 days of implementation receive the training. The training will be posted at the time clock. And everyone that is unable to attend one of the trainings can receive a one-on-one training with human resources. It is important that everyone is trained. Also, we would like to implement a standardized search checklist for the mental health techs and the nurses throughout all of the different departments in the hospital and on the units. Also, the mental health technicians provide patient searches and room checks twice per shift and as needed. We're going to also put that tool in use there. If everyone's using the same tool, the compliance will increase and the amount of contraband will decrease. This training will occur with the mental health technicians and the nursing staff. The nursing managers will be responsible for ensuring that all staff is trained. The nurse educator currently has nurse education binders on each unit. In these binders, she will put the new search protocol checklist along with the education and a signature sheet so that they can sign that they've received education. It will ultimately be the responsibility of the nurse educator to ensure everyone receives that training. The quality improvement nurse will also be a part of this as she receives every incident report in the hospital, and she will be able to tell from the implementation of the new standardized search protocol and the contraband wide hospital training, was it effective? Did we achieve what we plan to achieve with a decrease in incident reports? Every month, the quality improvement nurse does an Excel spreadsheet and she lists all these things. So we'll be able to tell if this is working. There are going to be some barriers by the staff buying in, thinking that they're going to have to do more work. When actually, it may take 30 minutes of training, but it's going to make their job much, much easier. Everyone's going to be using the same tool. All the staff's going to be on the same page, and it's going to result in less incident reports for the staff and increased safety on the units. So it's a win-win. We just have to buy in the staff. Also, currently, the process when a patient comes into the intake department, sometimes they have to wait 30 minutes or 2 hours before they finish their assessment and they do the contraband patient search. It's important that within the first 15 minutes of a patient coming in, that their vital signs are taken and that they meet with a nurse to do an assessment to check for physical, sexual assault or trauma so that we can search the patient and have those things in mind and be sensitive to those nature. The patient is more adapt to comply with the search if we know those things. So we need to get everyone on board with the training. Within 30 days, the entire hospital will be trained. All new hires this will be part of the new hire training. We will be able to assess their knowledge of the training based on the pre and the post test. The quality improvement nurse will have these results, as will the nurse educator, and that will give them an idea if it's working. Is the training effective? And we'll be able to tell that from the pre and the post test. It is imperative that every employee at the hospital understand and know what contraband is. Contraband can be introduced a couple of ways to the hospital. The patient can bring in contraband, staff can bring in contraband, or family members bringing in items for the patients can have contraband in them. When a patient's family member brings items to the front, the patient care tech checks these items. And that's why it's so important that everyone is on the same page with contraband and that we do a standardized checklist so that we can catch these things. What one person may think is contraband, another person may not. So the education on what's actually considered contraband is essential in providing a hospital with safe care and a safe environment that is contraband free. This is my quality improvement project. I hope that you've enjoyed the presentation. And we want the management of contraband in the psychiatric setting to not be an issue. But it is an issue. Thank you for your time. Brandy Humphreys.